Hi, my name is Ariel Alba, and I will be presenting on the Calgary Family Intervention Model. The Calgary Family Intervention Model is a family nursing theory. Family nursing theories are important because they provide a foundation for learning, understanding, and research. Research is furthered through studies that use theories to guide the research projects. This evidence-based research is what is used today in nursing practice. This model is a partner to the Calgary Family Assessment Model. Just as in nursing practice, interventions follow assessments. This model is unique because it is the first nursing intervention model. Calgary Family Intervention Model aims to improve many areas of family life through interventions within these three domains: cognitive, affective, and behavioral. The three domains are the key concepts and the framework to this model. The domains encompass many different parts of the family. The affective domain involves emotions and attitudes within the family. The cognitive domain involves the beliefs and perceptions of each family member. And the behavioral domain is self-explanatory as it involves the behavior of each family member. Behavior follows the emotions, beliefs, and attitudes from the affective and cognitive domains. It was difficult to find where the Calgary Family Intervention Model explicitly defined these words, but the words were used many times and were simple to conceptualize. For family, a family is described by the model as a system or a unit. For health, the model encompasses the many definitions of health. Through this model, nurses find interventions to help families reflect on and improve each aspect of their health. For environment, this is described as aspects of the community that surround the family, such as the neighborhood and the home. And for nursing, nursing is seen as being non-political and involving different cultures and social classes. In this next portion of my presentation, I will discuss how the Calgary Family Intervention Model has been applied. This will be done through a theory analysis and a discussion on a few published research articles. Calgary Family Intervention Model has been used successfully in many different family nursing practice settings to intervene and improve the cognitive, affective, and behavioral aspects of a family. The application of this model is demonstrated in these studies. The first is a study in the OBGYN setting aimed to provide educational interventions to improve understanding of family interactions and promote education for the family on health issues. The second study shows the model through the improvements in the physical and mental health of patients and their families. And this last study uses an intervention based on the model to improve the mental health of young adults and their families. First published research article that I would like to discuss was aimed to encourage healthy snack choices to prevent foodborne diseases in kids in Surabaya. This article used the three aspects of the Calgary Family Intervention Model: cognitive, affective, and behavioral, to guide the interventions. The interventions were guided by the model using interventions based on the three domains. So for the cognitive, information was given to families regarding the risk of foodborne diseases and why healthy snacks are a safer option. For the affective domain, conversations were had about the feelings and perspectives about food. This increased understanding of emotions towards food choices and health. And for the behavioral domain, families were involved in making and choosing healthier snack options with the goal of instilling a new routine. Findings in this first study found that the participating families had improved knowledge of how to prevent foodborne diseases through healthy snack choices, better mindset towards food, and behavioral changes to include making healthier snack choices. The interventions used in the study were guided by the Calgary Family Intervention Model, and those interventions were shown to be successful in helping families choose healthy snack options to prevent foodborne diseases. The second published research article aimed at evaluating the emotions and the influence of those emotions on families of those affected by dysphagia using a questionnaire. The research project and the study was guided by the Calgary Family Intervention Model. As for the cognitive domain, the understanding of dysphagia was improved not only by the patients and their families, but by healthcare providers as well. For the affective domain, the emotional responses towards dysphagia were assessed, which helps therapists determine the best interventions for each patient. Family members also had a better understanding of what the patient with dysphagia was feeling. And for the behavioral domain, a clearer understanding of the emotions that come from experiencing dysphagia helps the family members and healthcare providers alter their behavior toward the patient to include empathy, sympathy, and transpathy, ultimately leading to stronger family bonds. The second study found that the need for counseling and training is imperative in addressing the emotions of the patient and the family of those experiencing dysphagia. It was also found that the assessment tool guided by the Calgary Family Intervention Model was reliable and that there is a need for education for therapists helping patients and families with dysphagia. I will be applying this theory to the family I chose to assess by using its framework to design interventions based on the family assessment assignment. I chose this model because interventions are a huge part of nursing, and I believe it is important to understand interventions in family nursing as we are learning about family assessments. I believe having a framework to use when determining the best interventions is important to have so that foundation can be built upon through experience. I hope you enjoyed this presentation. Thank you for taking the time to listen. My references will follow this slide.